Well, welcome to today's update. Thank you for coming back as always. It is Tuesday, the 28th of April. Now, I've got some interesting information to bring you this morning. We're going to look at a study from the United States, and we want to look at some new data that's come out about the UK, as well as some international data published by the International Rescue Committee. So plenty of interesting bits and bobs today, but I want to start off with Iran, because this is very distressing, actually. There's no other way to describe it. It's appalling situation. Now, it comes from the National Coroner's Office in Iran, and I'll give you the UK news link to that article. Now, between the 20th of February and the 7th of April this year, there were 728 deaths from alcohol poisoning. And in the same time last year, because this is a known problem in Iran, at the same time last year, there were 66 cases. So about another 680 or whatever it is, more deaths than normal in Iran due to alcohol poisoning. Now, what's happening here is that there's disinformation going around Iran that drinking alcohol protects you against COVID-19 virus, and of course it does not. 60% alcohol solutions on your hands will kill viruses on your hands, but it won't work if you drink it. It's a ridiculous idea. So do not drink anything that's designed for external use. Don't drink any antiseptics, disinfectants, alcohols, things like that. And the background here that makes it particularly disturbing is that, as you probably know, there's two types of alcohol. There's ethyl alcohol and methyl alcohol, so ethanol and methanol. Now, it's the ethanol that you get in beer and wine and spirits, but methanol is poisonous alcohol that's produced by fermenting certain products, and it's sold in Iran for industrial purposes. They sell methanol, like we use methylated spirits, or we used to use them. I still use it for camping, for cooking when I'm camping. We use methylated spirits. And the Iranian government colour it, but what some unethical people in Iran have been doing is they've been putting a bit of bleach in to take out the colouring and selling it as ordinary alcohol. And then people buy it tragically believing it's going to protect them from the virus, which of course it's not. It's just going to kill them. So just terrible that there's been these deaths. So let me just obvious, don't drink any antiseptics, disinfectants, anything like that. Don't even think about it. And this ethanol poisoning is just a poignant example of that. Now, as well as the deaths, over 5,000 people were poisoned with methanol. Methanol is the poisonous sort. So drink methanol, go to the morgue. That's the way I remember it. M for methanol, M for morgue. And another tragic thing here is another 90 people or more, they're not really sure, but at least 90 people, because methanol can make you go blind. So over 90 people have got reduced eyesight or blindness as a result of drinking methanol. So just absolutely tragic what disinformation can do. Always check the information that you are given. Check the information I give you. Don't take information at face value. There's a lot of disinformation around. Now, and of course, I would like to think. I intend never prescribing anything online. It's just not what you can do. It's just not the way things work. Everything that you take should be individually prescribed for you by your doctor, as we've said so many times. Now, slightly better news. Australia. 12 new cases in the last 24 hours, which is excellent. So that's reduced massively and dramatically. And the Sydney beaches have reopened, so Sydney dwellers, what do you call someone who lives in Sydney? A Sydneyite? I really don't know. Anyway, they can now go for a swim, which they're very pleased about. Austria, again, I put on Austria there to illustrate that many places in Europe are starting a gradual reopening now, which is very encouraging. Now, the United States, rather than give a lot of different information today, I've just gone for one thing really. Now, we did mention this before. This is the prevalence of SARS, severe acute respiratory syndrome, coronavirus type 2, which is causing the COVID-19 pandemic, infections in infection in residents of a large homeless shelter in Boston. Now, this is just published yesterday by the Journal of the American Medical Association, but it was actually based on data that was collected about 3 weeks ago, I think. April the 3rd, I think it was collected. So what had happened here was prior symptoms. There'd been prior symptomatic people from screening or self-referrals outside. So it was known that this particular Boston homeless shelter could be harbouring cases. And what they did was the health authorities went in there and they tested 408 people. So the number tested was 408. Now, symptom assessment and SARS-CoV PCR test. In other words, they tested for the virus, the SARS coronavirus 2 virus, with a polymerase chain reaction test, which is the test for the virus, the so-called antigen test. And 147 of them were positive. That's 36% were positive in this one shelter. So a very high amount were positive. Now, we were a bit sceptical about this before, but now it's been published in the Journal of the American Medical Association. This means that this data will have been reviewed and is now highly trustworthy data because it's published in one of the world's most reputable medical journals. So, positive for SARS. So they tested everyone for SARS, and 147 were positive for the SARS coronavirus 2. Now, of these 147 that were positive, 87% were asymptomatic. So 87% of the 147 that tested positive, so these are people that are known to be positive, they have the virus at the time, were asymptomatic. Very high proportion. Now, we don't know how many went on to develop coronavirus symptoms. We know that some did develop COVID-19, but it shows that many people are asymptomatic or pre-symptomatic, and of course these are infectious, which tells us why this has been spreading so rapidly in many of our countries. Now, this was a cross-sectional study, so it's just like a snapshot in one day, so it has its limitations. But it does seem to show that for everyone that shows symptoms of COVID-19, there's more people that don't have symptoms at any given point in time. They may continue as being asymptomatic, or they may go on to develop symptoms. So symptom screening in homeless shelters may not adequately capture the extent of disease transmission in high-risk settings. And this is another point. I was praising South Africa yesterday because they've recruited many people that are doing home testing. And what they do is they'll go out and screen people for symptoms, and then if they've got symptoms, they'll send them in for evaluation. But this is looking like many people who have the virus will not be demonstrating symptoms, in this case 87.8%. So while these studies are good and worthwhile, and I encourage them, it's important to realise that they are limited and that we only get definitive data when we have huge amounts of testing. Now, as we saw yesterday in Kenya, they're developing a breath test. So wouldn't it be wonderful if you could just go round and your district nurse or your GP could just give you something to blow into, like that, and you go, oh yeah, you've got it, mate, or no, you haven't. I think that will come. Just can't come soon enough. Hopefully even simpler and cheaper. Hopefully as simple as doing a breathalyzer test by the side of the road. But we're not there yet, unfortunately. So we still have a lot of uncertainty. And the data from the UK also illustrates a lot of that uncertainty at the moment. Now, deaths in the UK, another 360 in the past 24 hours, 21,000 deaths. Now, the cases, the official number of cases are 158,348. So is it that, or is it 2.5 million? Now, the reason I'm throwing out that 2.5 million figure is it's not random, it's not arbitrary. But as we showed you yesterday, I'm using this app on my phone. That one. Can you see? Can you see that coronavirus tracker? So I'm using that, and from that you can look. So I can report my symptoms. Report your symptoms even if you're feeling well. So I'm reporting my symptoms. So me today. Have you had a test for COVID-19? No. Next question. I feel physically normal today. Donk. That's it. Done. So I've reported in for today. Now, this might seem a bit simplistic, but it's not, because the group that are collecting this data from Oxford University and a lot of other reputable centres in the UK, they need information about who's feeling well as well as who's feeling unwell, and their estimates. Now this app is used by about 2.6 million people in the UK, and I'm pretty sure there's one for the States as well, and I have posted links to this. So there's about 2.6 million people in the UK reporting in every day. And from that, it's not ludicrous to extrapolate up to the whole population. And if that's the case, they think about 2.5 million people have probably had this infection altogether. And what they're actually saying is, from the 1st to the 15th of April, symptomatic cases went down by 71%, which of course correlates very well with the time you would expect the lockdown in the UK to be effective. So they estimate that on the 1st of April there was 2 million people symptomatic, and that's down to 582,000 people symptomatic today, a reduction of 71%. Now, of course, this is not based on testing. It's not definitive numbers. It's based on a sample that volunteered to report. You know, I've never had so much feedback, shall we say, on a video as the one I put up about that app yesterday. Now, I'm using it, and many of you were appalled by that. And quite a few of you have realised that I now work for the British government and GCHQ, and all I'm interested in is getting your data. Let me tell you, that's not true, by the way. It's not true. I just think it helps people. It's as simple as that. I'm not working for the government. I'm not working for intelligence agencies, but I've chosen to download it. What you choose to do is up to you. Right, so for 2 million people, so that's down dramatically. But if what this means is, if there's well over 500,000 people with symptoms in the UK at the moment, and we know that people they can transmit the disease for a few days before they get symptoms and for 7 or 8 days after they get symptoms, then that means there's a lot of people are infectious. That's the trouble if you leave your phone. I wanted to show you that app. So from 2 million people down to 582,000. Therefore, if there's that many have symptoms, there's still many infectious people in the UK. So this shows there's a definite infection risk in the UK at the moment. This is why I think it's so important to wear masks. And I was very pleased to hear that Nicola Sturgeon, the First Minister of Scotland, is advocating, not mandating, but advocating the wearing of masks in public at the moment. And this group also say that symptoms change 2 weeks before hospital admissions. So this is what we've said as well. It's nice to have this confirmed. So they're saying that people will catch the infection, they'll incubate it, then they'll become symptomatic, or some of them will become symptomatic, and then the complications tend to occur about 2 weeks later. So they're saying there's a 2-week lag between people becoming symptomatic and people being hospitalised, and a longer lag until people die. So interesting to get that confirmed. Now, the main thing about the UK I want to bring you today is, just the point about that. So basically, we have moderate amounts of testing in the UK, and maybe we've got 20 times more cases than we think. So that means that probably 3-4% of the population, 4 or 5%, I can't quite work it out, 2, 3, 4, 5% of the population could have had this virus already. And that could be the case in many parts of the world. Now, that's not a lot, because we need 60 or 70% for herd immunity. So it still means we're near the beginning. But it still means that these official numbers are gross underestimates. And I think that's going to be the same pretty well wherever you are in the world. So it's important lessons to learn globally there. Now, Office for National Statistics, as we know, publishes every week. Now, last time I put this up, I got told off for being way behind the times. I know it's whatever date it is now. I know it's the 28th of April now, and this goes up to the 17th. But this is all the figures go up to. So this is what we've got. So interesting to look at these figures from the Office for National Statistics. Now, the week ending the 17th of April is what they count as week 16 of the year. And in that time, there was 22,351 deaths in that week. So up to the week up to the 17th of April, there was 22,000 deaths. And this is 3,835 more deaths than the week before. So up to the 10th of April, there was that many, and this is increased now. So 3,853 deaths more than the week before. And more importantly than that, this is 11,854 more than the 5-year average. So this is more than the 5-year average by quite a long way. And in fact, it's the highest weekly total recorded deaths since comparable figures started to be collected in this country in 1993. So we're definitely seeing an increase in deaths in the UK. Now, 8,758, 39.2% of all deaths mentioned COVID-19 in England. This is England and Wales, not the UK, sorry. England and Wales. So COVID-19 is involved basically in 40% of deaths in the UK at the moment. And that's 6,213. That was 33.6% in week 15. So what this is saying is the week up to the 17th of April, there was 39.2% of deaths involved COVID-19, and that was up on the previous week from 33.6% of all deaths. So again, we can see that the percentage of all deaths has gone up by almost 6% of those attributable or those involving COVID-19. London, it was 55% of deaths registered in the week, that single week up to the 17th of April. Now, deaths for care homes for week 16 was 7,316. And of course, these aren't counted in the official government figures, so we need to add these to the official government figures. And we'll see a graph that explains that very well in a minute. And again, that was quite a lot higher than in week 15. And almost double the number in week 14 and almost triple the number in week 13. So these are all deaths from care homes. So what we're saying is that deaths in care homes for week 16 up to the 17th of April were that, 7,316. That was 2,389 higher than the week before. And the numbers of almost double the numbers from week 14, which was the week before this, and treble the number from week 13. So the numbers have trebled in the last 4 weeks in care homes, which of course we did warn about many times on this video. Now let me show you some graphs that probably illustrate this more clearly. So here we have the number of deaths registered by week, England and Wales. And this is for the year up to the 17th of April, basically. So we can see that the deaths here, all deaths are kind of normal, a little below the 5-year average. And here's the 5-year average of deaths here. And this is the actual deaths that we're having. So we see this steep increase in the number of deaths. And on the bottom line here, these are deaths which are attributable to particular causes. So this is influenza and pneumonia. 5-year average. This is influenza and pneumonia actually this year, a little below average. And this is kind of what we would expect here. But then we see that the COVID-19 deaths have gone up and then dramatically up. So we see that most of this increase here is explained by the increase in COVID-19 deaths there. Now, this is the graphic I told you about before. So these are the deaths in a hospital. So the blue, all these deaths are in hospitals here. And the ones in red are in care homes. And these orange ones are at home. And this is people that died in other places. So we see that most people in the UK are dying in hospital. Now, I know that number's tailing off there. So it looks like things are getting better up to the 17th of April. But in actual fact, they're not. That's because there's a lag in death registrations. So these are death registrations rather than deaths. So the real number of deaths, unfortunately, will have kept going up. It's just that you don't see it because there's a lag with the registrations. But the powerful point here is we can see that the red line, which is the proportion of deaths in care homes, is going up. So this red component of the total number, the deaths in care homes, are unfortunately going up. And that will probably carry on for the next week or so. As we anticipated many times on this video, these institutional deaths that we've been anticipating. Just a pity more precautions weren't taken as soon as it was flagged up. Now, year-to-date analysis for deaths registered involving COVID-19 by sex and age. Right. So as we see, in every age group, more men in blue are dying than women for deaths involving COVID-19. So we see more men are dying of COVID-19. And we also see, thankfully, no associated deaths in the younger age group. Although yesterday we did talk about this new paediatric inflammatory syndrome that we're worried about. More details on that tomorrow, hopefully. But we see the deaths here goes up with increasing age. And the reason it's lower here, over the age of 85, is a lot of people have already died. But their chances of dying if they become infected are greater than this group. It's just that there are less of them left alive. Deaths by age group, England and Wales. So this is deaths by age group. This is all deaths, and this is COVID deaths. So here, for example, if we look at this age group, this is all deaths, and this is COVID deaths. So we can see that quite a large proportion of deaths currently are attributable to COVID-19. Even in the younger age group, this is all deaths, and this is the deaths attributable to COVID-19. And tragically, even in the 15 to 44 group, and there is some small amounts there as well. But we see again that women are dying less, men are dying more. And that graphic there just shows the demographic of the population, so you can compare. So most people are aged 15 to 44. We'll come back to that one. Now, so we see a lot more deaths in care facilities in the UK, unfortunately, as well as an overall increase in deaths. But we knew this last month because there was more local burials. So this has been fairly obvious, this trend, for some time. And we probably haven't quite reached the peak of deaths. We could well be at the peak. Hopefully we're past the peak now. But so the statistics that come out next time from the Office for National Statistics, which will be in a week's time, for the week from the 17th to the 24th, I'm afraid that might well be the peak week for deaths. So we'll be looking at that then, hopefully. Now, just a few problem cases around the world now to flag up. The International Rescue Committee. So the International Rescue Committee is a big organisation, headquarters in New York. It's run by David Miliband, who used to be a UK politician. Now they're saying that overall there could be 1 billion infections with COVID-19 and 3.2 million deaths. Now that's what they're saying. But I don't see how it's going to be as low as this, quite honestly, because it's hard to see that this virus is going to stop spreading till it's infected 60 or 70% of the world's population. So I'm afraid I expect this to be perhaps 4 or 5 billion people that could be infected with COVID-19. I hope they're right and I'm wrong, but I would be surprised. I would be surprised if they're right. Let's hope they are. So I'm still anticipating perhaps 4 or 5 billion people being infected with this virus before we get a vaccine. Let's hope it's let's hope at 1 billion. I mean, the International Rescue Committee does have people that are a lot cleverer than me working for them, so let's hope they're right. And they're estimating 3.2 million deaths. Now, the numbers of deaths I estimate are higher than that as well. So again, let's hope they're right and I'm wrong. Now, a few problem areas that we've been talking about this since January on this video. So just quickly a few examples. Yemen, there's almost certainly community transmission now, and there's the risk of other diseases such as cholera. And again, we don't want to get COVID-19 with other diseases because it's going to be more severe. In Yemen, as you know, due to the war, more than half of the healthcare facilities no longer functioning. 18 million people don't have access to proper hygiene, so how can we teach people to wash their hands if they don't have access to hygiene, water and sanitation? 18 million people. It's going to be very hard for these people to protect themselves. And if there's already community transmission, as we suspect, then the virus will be spreading very rapidly in Yemen. And social unrest caused by the war and by instability caused by the virus is going to have other consequences as well. And unfortunately, they fear particularly violence against women. So quite concerning there. South Sudan, again, they flag up. Less than half the country's health facilities are functioning. 24 ICU beds and 4 ventilators for the country. Already gripped by malnutrition, and many face famine, and we know that malnutrition predisposes to immunosuppression. Another problem place, Venezuela. As you know, there's massive economic problems, massive migration out of the country. More than half the doctors have left Venezuela. So very low on medical staff. 90% of hospitals face shortages of medicine and critical supplies. 84 intensive care beds for a population of 32 million. And other countries they mentioned, Burkina Faso, 11 ventilators for a population of 20 million, 21 million. It's not that ventilators might be massively, I know there's controversy about ventilators, but it just shows what critical care facilities these countries don't have. Sierra Leone, 13 ventilators for 7.9 million. Central African Republic, 3 ventilators for 4.8 million. Somalia, 15 ICU beds for a population of 15.8 million. Okay, there's more I was going to bring you today. I think I might leave some for tomorrow. That's probably about long enough for today. Let's close with a few. Let's close with Liz's infographic first before we have some viewers' pictures. Now, this is the rather crude infographic I drew the other day, and Liz has done a much neater one. And these are accessible from the website. You can log on to my website and download these, which I'll put a link for, which of course is very kind of Liz to make available. Now, we're attacking this with a vaccine, which will then generate herd immunity, as will people who've had the infection, social distancing, face covering, therapeutics not there yet, unfortunately, antigen testing, lockdown, antibody testing. All these things are we using to attack the virus. This is the one that's going to eradicate it. So until then, we have to use these other strategies. Now, just a few viewers' pictures for today, viewers from around the world. Thank you for sending these in, everyone. So this is Joe from California. I suspect that's a homemade mask, Joe. Very colourful. And it will prevent you infecting other people if you are unfortunate enough to be infected. So I'm glad to see you are wearing that, and also glad to see you are watching in California. Wish we had some of your weather. Now, there's a little me in the corner. This is Johan, who's watching while he does a bit of welding. Hope you don't burn yourself, Johan, in Sweden. This is John in Panama. I mean, just look at that view. Fantastic view, John. And thank you for watching in Panama. Great to see you're watching there in a beautiful South America. I've never been. I'd love to go. Now this is Dixie, who's watching up here. And she's owned by Melissa. So glad to see Dixie's taking an interest. Now this is Michael in Canada. Now Michael's obviously got a dual screen computer because I'm on there and he must be watching me on the front. I think he must be, mustn't he? Otherwise he won't be able to see anything. That's Michael in Canada. Now actually he listens at work, so that's good to know. This is Nathaniel and Julie in Australia. Watching in sunny Australia. Thank you for watching. Thank you for the picture. Now this is Udan in Canada. He's not on, but he watches me while he goes jogging. So this is his jogging machine, and he watches on this nice big screen when he's jogging. This is Wendy in I can't quite remember where, Australia somewhere. I can't quite remember where. Southeastern Australia, I think. And this is the dog London. Now there's been a bit of trouble with London lately because he won't go for his walk until after the video. So if I get the video on late, then presumably London gets his walk later. But thanks to Wendy for sending that in. Great picture. This is Winnie in Malaysia, who seems to have started growing her own food, which of course is a great idea. So I do hope you've planted that, Winnie, and grow up some more sweet potatoes. Okay, everyone, thank you for watching and listening as always.